All right, so the question came in. So Dr. Marble, you've got all of these opinions about shoes. So what exactly is bad and what exactly is good? So I'm going to take the opportunity right now in this video to discuss that. I have patients come in and they have either painful bunions or they have issues with their heels. And especially with all the concrete and pavement that we have to walk on nowadays, there's definitely some shoes that are going to lend themselves to actually causing more pain. And so I'm going to go through some examples of what to look for and what to not look for. So first of all, this is a shoe that I see fairly frequently. It's from Skechers. The shoe, what you're looking for in a good shoe is that it should bend here, yes, but it should not bend here. So you can see actually all the bend that's occurring in that shank. Also, the other problem with this shoe is that it doesn't have any midsole to it. You can see how thin that sole is on the outside there. Even though there is an insole there that we could take out and maybe put something else in its place, this is still not going to be structurally very good for your foot. So that's one option. Also, I see this a lot. You're familiar with the Crocs. This is, even around the house, it's just not the best thing. Again, it bends here, it bends here. You can actually wring it like a towel, put it in your pocket. That's just not going to be helpful for all the concrete and pavement that you're interacting with. Now these are two options. This one doesn't have any back to it, but the principle is still the same. There's very minimal midsole to it, and actually the heel itself, as far as a workhorse type of shoe, yeah, if you need to dress up and maybe use them for an hour or two here or there, that's okay if you don't have any pain in your feet. But just by virtue of having a heel to it, what's happening is the Achilles tendon is accommodating for that height, and so your Achilles tendon actually gets tighter as you are wearing something this for a long periods of time. So you know, as far as going to work and having to wear something nice, as a lot of my patients will say, I have to write notes for them to go to work and wear something that is going to be helpful, especially if they're doing a lot of walking around their job that's not going to involve a heel. With this shoe that doesn't have any kind of a strap to it, what ends up happening is the tendons on the front of your foot end up having to work harder to be able to keep the shoe on in the first place. Get a lot of tendonitis across the front of people's ankles as a result of a shoe like that. It includes flip-flops as well. Now, as far as a good shoe, here's a good example. This is a Reebok DMX. The DMX system has a good midsole. It goes all the way from the heel to the front of the foot. It bends here, yes. It does not bend in the shank. Has a good midsole to it. The other nice thing about this shoe is that it's helpful for elderly patients that have a difficult time lacing up their shoes. This Velcro enclosure is very good for that. Now, so I've talked about some good examples. Also, just by kind of a side note, this is a post-op shoe. This is the type of shoe that you would use if you had any kind of a fractured bone in the foot that's been diagnosed on x-ray, for instance. Many times, unfortunately, though, the shoe that they give you at the emergency room is literally just a flat board that you put on your foot. And this has a little bit more of an upturn to it, but it still has the stiffness across the ball of the foot and the shank. You want to have the stiffness all the way across if we're dealing with any kind of a fracture injury. And so those are my suggestions for shoes. What is some examples of what is a good shoe, what isn't a bad shoe. We are grateful that you watch these videos, and recommend that you subscribe to our YouTube channel, and also turn on your notifications as well, so that when another one of these comes out, you'd be able to know right away. Thank you for watching.